We're going to talk about some questions that have been submitted by people around the world that have PC, or Pachyonychia Congenita. The first one says, how do I know for sure if I have PC and not some other disease? And that's a good question. For many years, Pachyonychia Congenita was a constellation of symptoms that, when acquired together, would make a diagnosis. So if people with PC had thick nails, they had calluses on their palms, they often had the white tongue, they had the follicular hyperkeratosis that Sam talked about, the little bumps on the sides that Nathan had and on the elbows. Those were the characteristics of PC. Now, there's additional symptoms that fit into different types, and people have subtyped and divided those into areas. Recently, we've been able to take genetic material and actually find the mutation in the gene. And that confirms the diagnosis, although we find that the mutation can be in one of a couple of different genes and still have that same phenotype we talked about. So the diagnosis is based on both the phenotype now as well as the genotype, and both can be done. Dr. Bleachman, anything you would add to that?
No, I think that's a great explanation. I think one of the things that's a challenge is to actually know for sure if you do have Pachyonychia Congenita, because it's so rare that most doctors don't even know. And even if you get into the specialty of dermatology, it's so rare that there are very few dermatologists who see a lot of it. However, it is very distinctive, and so most dermatologists, if they look into it, can figure out what it is. But once they find out, we still don't know what to do about it. So that's sort of what our mission is, I think. But we won't get onto that. I'll go to the next question. Let's see. The next question. Why do different people seem to have different experiences and symptoms? So that's a really good question, and I think it's a pretty complicated question because it may have something to do with the genes that we talked about earlier, the keratin 6A, keratin 6B, keratin 16, or keratin 17. If you have a mutation in any one of those, you do get the thick nails and the thick palms and soles that we just talked about. But maybe people who have a mutation in 6A have a slightly different presentation than the people who have a mutation in keratin 16. The other thing is that everybody comes to Pachyonychia Congenita with a different genetic background. So in other words, there's some people who have atopic dermatitis, another condition. It's pretty common. What if you get atopic dermatitis at the same time as you get Pachyonychia Congenita? That's going to be a little bit different than somebody who doesn't have that. All right? And so people are very diverse. People have a lot of different genes and a lot of different skin conditions, a lot of different features of their skin that may sort of be a background that when Pachyonychia Congenita is superimposed on that background, there may be subtle differences. Maybe one person's tongue has a white spot that's not very prominent at all, but another person has one that is very prominent, and they have exactly the same mutation, but it's because of other genetic characteristics that they have. Does that make sense? Yeah.
Another question is almost related to that. It says, why do some people with PC seem worse than others? And this has, again, possibly a genetic background. People with certain keratin defects may have a more severe expression than people with others. The other thing is that trauma, we think, plays a big role in this. And so if it's an area where there's a lot of trauma or people take care of it differently, it may affect the way it's expressed. I think both of those are important in terms of the severity of the disease.
Okay. Well, I think I answered this question. It was which genes cause PC. I just said that, 6A, 6B, 16, and 17. And do we know which genes cause which symptoms? No, we don't. I think that's a great question to highlight the fact that there's a lot left to learn. We have a long way to go before we have all of the answers.
And the next question says, I would really like to know about the severity of PC as it's passed down through generations. What are the chances of someone with a milder case of PC passing down the same level of PC versus a more severe case? And again, we've kind of answered this a little bit. The gene continues to be passed, but the expression of that gene can be more severe or milder depending on many conditions. It can be underlying disease, it can be trauma, it can be other factors we don't even understand, that some people express it more severely than others.
May I just ask a follow-up question? it would be correct that, for example, Jan would only be giving to her children 6A, the same mutation that she has, not something more severe or different.
That's correct. And her
So she wouldn't
children
be-
would express the same genetic defect if they have symptoms of PC, obviously. But if one of the children had an underlying disease, as Dr. Leach mentioned, if they have atopic dermatitis, or if they have something else
something else themselves,
themselves,
that they
then it may be
inherited.
expressed slightly differently.
Okay.
But it would still be the same genetic defect.
Okay.
So I think that's a really great question, because I think some people have this feeling that it may be getting worse from generation to generation. But as far as we know, that's not the case at all. The mutation that the first founder has is the same mutation that gets passed on to the next generation and the generation after that. And as far as we know, there is no increased phenotype. There's no worsening of the phenotype as you go from generation to generation.
That's what I noticed in our family, from my grandmother to my dad to my uncles, my aunts. They were all the same condition. Never worse, never less.
Yeah.
They're all the same.
Unless you didn't walk on your feet anymore.
Yeah.
Good. Was it my turn or
Since you
your
take
turn?
number 6.
Number 6. Okay. Why do my feet hurt when I stand and others don't? Sounds like somebody wanted to know what caused the pain. And we're not sure what causes the pain. Again, there's a lot of unknowns. I keep saying we don't know. But we believe that part of the problem with PC, as I mentioned before, is that you get blistering. And that blistering, I think everybody can relate. If you've ever had a blister on your body, that blistering, that skin that's been blistered is exquisitely sensitive. I mean, it's very, very tender. And if you can imagine that on the PC feet, on the bottom of their PC feet, where they have, basically their skin has split like a blister in a large area of the bottom of their foot, of course it would be incredibly tender to walk on. That would be incredibly painful, and it is. And I think that's sort of in a not very technical explanation. That's what I think they're feeling. Do you have?
I would agree. That's certainly my understanding of this.
And why one might be able to walk and another patient might not. Maybe just pain level of an individual. What they
Right.
feel.
I mean, it's interesting. You know, it would be, I mean, there would be, that's right. People have different thresholds for pain. And that's clear in every aspect of medicine, not just with PC. That's one component of the pain that you feel, is how well can you deal with that pain. There's another component to that, too, I think, which is that maybe people that, well, let's just leave it there.
Okay.
Let's
Okay.
Question number 7 says,
not
why
get too theoretical.
that's right. We could speculate a lot.
That's right,
but
that's right.
Why can some people with PC file their nails flat while others can't? And the easy answer to that would be, I have no clue. But let me take a guess as to what I think might be happening. And that is that the nail has a nail plate and a nail bed. And in PC, this the connection between the two is disrupted, so you get a lot of debris that builds up and makes that nail thicken. Now, if in that area you get some trauma that produces increased blood vessels into that area, then if you start to file that down, you're going to get into very sensitive tissue, because nerves will follow that blood vessel, and you'll get down to a point where you get real tender and painful as you're trying to file that flat, but the nail isn't flat. It's still raised and inflamed. And so that some people would be able to file their nails down where they don't have those blood vessels. Other people where they have that invades that tissue would have a very difficult time filing the nails flat. And Dr. Leachman, I don't know what you thought might be an explanation.
Yeah, I don't think anybody knows. I think that's a really good point, that there may be a difference in the amount of neurovascular network that forms between different patients. But again, we don't know why.
And it will be interesting, too, just as we look at some of the nails, the difference between Russell's nails and Jan's nails. There are differences in individuals, so that'll be fun when we can find out
Right.
more.
Right.
So I do have one that I can't trim because of
I
the
see
nerve
that.
is underneath.
You can
the
feel
nail.
it.
And that's as far as I can go with it. Go any farther, then I'm going to cut nerve.
From
And the
blood.
others are okay. I got one
Incredibly painful.
that, yes.
Right. Is it your turn or mine?
That's your turn, Dr. Richmond.
All right. Why should I trim my feet or my nails? What should I know about trimming? And does it matter if my tools are sterile? Well,
It's a mouthful.
let's do one at a time. And I want some chiming in on by Dr. Hansen here too. Why should I trim my feet or nails? I think that it was best said by a Pachyonychia Congenita patient at the SID meeting that came, and she said, it's not an option. It's really not an option. I have to do it because if I don't, it becomes so tender or so problematic that I can't function. So it's not, that's my best understanding, and I think that would be a great thing for
Yes.
you guys to chime in. Do you agree with that statement that it's not an option? You have to do some sort of trimming and grooming to make
I
it
wouldn't
work.
be able to get my boots on or off because my toenails go up and hit against the top of my boots, and I wear steel-toed boots, so there's no giving there. And
Right.
I have to trim them, and if I don't do it in the proper time, the toe is sore for quite a while, even after I have trimmed it, because of the trauma of it hitting the top of the boot.
And I even know for me, it makes me so uncomfortable, my sores, that if I need to trim them and I say, oh, I'm just going to go to bed, I'm too tired, they'll wake me up at 2 or 3 in the morning, and I'll be, oh, I'm so tired. And all, because there's just a feeling they get that they bother me so much. I also find I get, I don't know if you get it, Russell, but an itch underneath
Oh, yes.
my sores. And if it gets too thick, you just can't get to it. And so I know that. Cut that part out.
That's interesting. You know, I've never heard, and I think this is a great example of how doctors learn from patients' experiences. I've really never heard of anybody describe Pachyonychia congenita as itchy before. So that's a
We've got
new
two
one.
people here.
Yep.
It's like a deep itch.
That's a new one.
It's like way in the foot. You're going.
Right now, it's kind of itching.
It's great.
Yeah.
So the second question on this card was, what should I know about trimming? And I think that it's an individualized process for each person, and that each person sort of tailors their trimming and everything to their specific needs. And so I don't want to be dogmatic. I don't think that the answer is to say, you must do it this way. Because, as my mother would say, there are a lot of ways to skin a cat. And that's really true, I think, with Pachyonychia
Skinning our
congenita.
feet.
Yeah,
That's what-
there's a
what is
lot
skin a
of
foot?
different ways. A lot of ways to skin your foot. So I think I think what you need to know is you need to know about safety, and you need to know about effectiveness, and you need to know about protecting yourself against infection. So I think that addresses sort of the last question a little bit. It says, does it matter if my tools are sterile? Well, I don't think that anybody's tools need to be sterile, absolutely sterile, but they need to be clean. Because the fact of the matter is that we know that the skin has bacteria on it all the time, and fortunately we're all blessed with wonderful immune systems. So that the immune system in general keeps up with what you're doing to your skin with little minor traumas. But if you have a dirty blade that you're trying to shave and you get into the bloodstream, it is possible that you've introduced so much bacteria or so much of an agent that could be infectious that could cause a problem, could cause an infection. So at one end, I guess what I'm trying to explain is I don't like either ends of the extreme there. I don't think that you need to be so preoccupied with making everything so sterile that it consumes a huge percentage of your time. On the other hand, I think that it's only for your own safety that you make sure that all your instruments that you're using are clean. And if it's something that you can get that's fairly sterile, like a blade, if you can change the blade out routinely so that it is fairly sterile, then use that. Does that, I don't know if that, does that sort of fit with?
I've wondered, like, especially when I trim my boys' nails, and sometimes I'll trim them and they'll get pus out of them. Is that the time then to sterilize it, or can you just keep going? Does that just sound like the dumbest question?
No.
I'll let you.
Thanks. What I would say is you would finish up and then change the blade. That
Even if I drew pus on
the
one?
pus you're getting out there it may or may not be infectious pus. Pus is a sign of inflammation. And that may or may not be a true infection, okay? So that you could take and clean that area off and trim and then get rid of the blade. But every time you get into it, I don't think you need to change blades 7 times if you're doing those.
Well, that reminds me, I know people have asked, is that pus that they get to, we call it pus, it's
Yeah.
just clear liquid. It's like, so is that just inflammation
It's more inflammation, or even if there's blistering or separation, you'll get fluid in the in the cells, and you'll open that up, and that fluid will run out, and it's usually quite clear.
Okay.
If it's pus, it has more of that the thicker, creamier consistency to it. And if it's truly true, and usually if it's true infection, it'll be painful. I mean, it would be the kind of thing where they're complaining of pain. Now, if that were the case, that changes everything.
Sure.
Okay.
Right,
When you do
and I
that.
think that you've mentioned before too that you've noticed that sometimes you'll get the red streaks that come from when you've really got a true infection, and that is a dangerous. I just want to mention it here for the video because I think that it's something. If anybody ever sees anything like that, they need to get to the doctor. That's the point where that infection is traveling up, and they need to be put on some antibiotics and really made sure that doesn't get into their bloodstream and cause them a life-threatening problem.
When they see the red line.
Yes.
Yeah, and that's a spread into the skin, and that's a concern,
Okay.
no doubt about
My
it.
last infected now have a red streak on my finger.
And we took him to the doctor.
It was like painful, like right up to here.
Wow.
Can be.
So it's a good thing we live in the modern era where we have antibiotics.
Yeah.
Because you were cured from that infection.
Yeah, and one time there was, it was like a month or so from this other infection. I was just like, just playing with my nose with my pencil, poking it in. It kind of went through it. There was like this hole. I got pus that was from my last infected now.
Mm-hmm.
It was but that one wasn't contagious at all.
Yeah.
I think it's your turn.
Yeah,
for
it
the
is.
next
And this
one.
is just an extension of the same question. It says, how can I avoid nail infections? We've talked about some of those things. Nail infections can be bacterial, they can be viral, and they can even be fungal. And so all of those are potential things. One of the interesting things is that many times people look at PC nails and say, oh, you've got fungus. Why don't you get your fungus treated?
Yeah.
And one of the things that you need to understand is that fungus usually is not a part of the PC nail. Although fungus nails can sometimes have that same thickening, they don't have organisms in that nail that cause it. So that certainly using sterile instruments and avoiding or rapidly treating acute infections are very important in terms of care of those nails to do that. Richmond?
Okay. Are the red dots in my sores the nerve endings? Well, I can finally answer this one. This is no, they're not. The red dots are blood vessels. Now, the thing that Dr. Hansen mentioned, why do people think that they're nerve endings? Or why? Well, because the nerves travel side by side with the blood vessels. You can't see the nerves. They're not. It's not really able to distinguish. You're not able to distinguish those. But when you have a blood vessel that then gets clotted, you can see that little. It almost looks like really dark red or a black point. And it happens in a lot of conditions. It happens in warts, too. And people used to think that those little things were the roots of the warts, but they're not. They're the blood vessels. But they do represent that vascular system where the nerves are also traveling in many cases. So we call it a neurovascular bundle or a neurovascular formation. Anyway, so that's the red dots, and the sores are the blood vessels.
The next question is, I was told that breathing the nail dust can be harmful. What do you think about that? Nail dust is merely keratin that's been aerosolized. I would probably not go out of my way to breathe any kind of dust. But there's nothing uniquely dangerous about the keratin any more than there is skin or other keratin proteins when you do that. So that obviously you would take precautions not to breathe it, but there would be no immediate harm if you were to breathe a little bit of the dust as you're filing or taking care of nails. And Leachman, you would agree?
Yeah. I don't think that. I'm not sure what the concern was about the nail dust in particular. maybe that during the dremeling process or whatever,
Be my
that
guess,
there would
isn't
be
it?
much more dust than in, just a normal filing sort of situation. And you wouldn't go out. It's just like you said, you wouldn't go out of your way, but, I wouldn't be paranoid about it either. I wonder who this one came from. It says, I have keratin 6A. I think they mean a keratin 6A mutation. Does that mean I have keratin 16 too? Is that what it means when they say genes are in pairs? That's a good question. So I don't know how much detail we want to go into, but I think in an earlier session, an earlier question that was asked was a similar thing. And the keratins, in order to form these nice filaments, have to be in pairs. And so keratin 6A pairs with keratin 16. And keratin 6B pairs with keratin 17. And so you can have a mutation in any one of those, and you cause PC.
That particular question, there was a big, long question, and I kind of summarized it on the card. They thought if they had a mutation in 6A, it automatically meant they also had a mutation in K16. And
No.
I heard tonight that's not true. You just have one mutation, you have PC. And also you answered another part of that you can't match up and say 6A goes with this and 16 goes with that. We just don't know that yet.
Right.
Okay.
The question says, why should I see a doctor for PC when there's no cure right now, and I think seeing a doctor is basically a waste of my time? And if I do see a doctor, what kind of a doctor should I go to? These questions are always a little self-serving. There certainly are situations where many PC patients know a lot more about their disease than many physicians. It's sufficiently uncommon that it's difficult to get a broad experience with PC patients. Dr. Leachman, among others, is fortunate to have some families with PC that have taught her a great deal about taking care of it. I think it's important to have a good physician relationship for some of the things we talked about tonight, and that is if infections or complications need to be looked at and treated quickly. Okay, so having ready access to a physician is very important, mostly for complications. I think that the physician can help to instruct the patients in the way in which they should take care of their skin, things that make it worse, things that make it better, and particularly someone who doesn't have a broad family experience would be even more important. Often in families, and Russell's mentioned in his family that a lot of this is passed from generation to generation. This is how you take care of things to do that. We think dermatologists are the ones who have the greatest experience with PC because it's very uncommon. And even in the dermatologists, there were ones that will tend to specialize and be more interested in this type of disease than others. And so if there's a medical center that has a dermatology program, or if you can call those, they will usually know those physicians that have an interest in PC.
Yeah, and we're hoping to as we grow, get even a better group of people together that really are the people that are the most interested. I also just wanted to add that I think that PC patients, it's my opinion, that not only, I think that dermatologists, there's sort of kind of two different types of dermatologists. You might want to see one for the nails and another for the skin, the thickened skin, because they tend to be two different types of people. And you want to use whatever resources you have in your community. So perhaps there's a podiatrist in your community that has a very strong interest, and they have a lot of abilities to help out in a different way than maybe the dermatologist might be able to. Or perhaps there's other specialists who might have, just for one reason or another, maybe a geneticist who has gotten a strong interest. And so we're not trying to be exclusionary. It's just that in general, it's the dermatologists who have the greatest interest in these kind of conditions.
For an infection, you need to go to a medical doctor, so you couldn't go to a podiatrist for that type of thing. You'd go to a podiatrist for maybe help with
the shoes or with the toenails.
Even the calluses sometimes
Right.
that can be helpful.
Calluses, I
Right.
see. And the medical doctors for infections or understanding or getting in touch with what's going on. And
Right. I mean, there are certain medications that you might need to get from a medical doctor that a podiatrist would not be able to prescribe.
Mm-hmm.
Right.
when we were growing up, my brother and I, we would go to a podiatrist, and he would trim our feet once a month. We would just take the bus and go downtown, and he would trim our feet once a month.
They have a lot of experience in that, and they're sometimes very good if they have an interest in it.
Right, yes, and he was very
Yeah.
We hope to do another section just on care, and that will be interesting to go into that. You're moving right along. If you've got a few more.
Yes, just a couple more.
Is
Dr.
it
Leachman, I
my
think it's
turn
you.
again? Many doctors don't know anything about PC. What should I tell my doctor? Well, okay. I think that this is a great time to just step back a minute and say, look, the doctor-patient relationship is just like any other relationship in the history of the world. It's unique. The particular doctor that you're talking about and the particular patient that you're talking about influences the answer to this question dramatically. Because there are some patients that want a particular type of doctor. So there are certain people who have been raised that their doctor is supposed to treat them sort of in a paternalistic way as a child. There are other patients who want to be treated as an equal in that relationship and work together. And there are certain doctors who can correspondingly do those types of relationships better or worse than other doctors. And so I think the key to this question is when you say most doctors don't know anything about PC, how do I tell my doctor that? You have to tailor. A PC patient certainly can educate the physician. They can educate them not only about the disorder if they haven't ever heard of it, but they can educate the doctor on their own individual findings and their individual needs. But you have to figure out as a patient how to make contact at a personal level with that physician. You have to figure out how to communicate most effectively with that physician. And so I don't think there's really a right or a wrong answer. I think it depends on the particular doctor that you have. Some doctors would appreciate it if you brought a packet to them and said, here's some information about PC, and we're going to try to offer that for some of the patients to take. Other doctors would be offended by that. Honestly, they would say, I can read and discover my own literature, thank you very much. You don't need to be telling me, I'm supposed to be telling you. In which case, maybe the patient would need to take a different strategy to communicate that a little bit more effectively.
Good answer. That's really true. The next question is kind of, deals with the same subject. Every time I go to a specialist, they want to put me on parade and have a lot of other doctors look at me. Why do they do this? What good does this do?
We all laugh.
Everybody's laughing.
And all these people have been on parade. There's no question but when a PC patient comes in, and particularly if a physician has an interest in this, he'll want to share that as a teaching experience to say, listen, here's as an uncommon genetic disorder that we don't get to see very often. We want to show examples of what this does, and so you would recognize it in your own practice. This is particularly true of a teaching situation, of medical students, of residents, those that are in a learning situation. This would be one of the few opportunities they would have to actually see and experience this disease. Obviously, the reason they do that is that very thing. It's an educational purpose. The other thing that does happen is that sometimes a patient will be asked to come to what they call grand rounds or a conference of some kind where many physicians are coming together. What you hope to obtain by that is a wealth of experience from the entire group and say, well, yes, I cared for a family back in Michigan, and these are some things we found to be helpful. Or I once had a patient in Alabama who had this, and here's some things that we found to be helpful there. So that joint experience in uncommon diseases can be very helpful in the management of disease.
Okay. I'm going to skip this question because there's not an answer. So.
Okay.
These are tough ones. Why don't we just go to the last? Because this is the hidradenitis suppurativa question.
Those are two. There are two questions that were submitted. That
Another
we wanted
about
to just
wrestling.
make the comment that there were two questions submitted that were for specific cases, which we're not using in this, where someone had asked about a specific therapy, and a second one asked about a specific condition, and we just wanted you to comment on why we're not answering.
Okay, I can do that.
Don't answer the questions, but I
I can
wanted
do
you
that.
to see the question so that everyone knew we put in every
Right.
question we got.
Right. Okay, so my next question is, there are two questions that are sort of lumped together, and they're questions about specific therapies. And I don't think I'm going to answer these questions tonight because, number one, we don't know the answers, and it would be inappropriate for me to really discuss an answer to those questions. And number two, we don't have enough experience historically to be able to give a good database answer. So once we have a little bit better information to be able to pass on, we'll do that. We want to make certain that we don't pass on any misinformation. So.
Wow.